Dear journalists, we continue our work. We are going to talk on the topic on psychological rehabilitation of the ATO fighters, the problems, prospects. Our speakers will include Olga Bogomolets, MP from the Petro Poroshenko Bloc, chairman of the Parliamentary Committee on Health, advisor to the President of Ukraine, and Artur Derevyanko, head of the State Service for War Veterans and ATO fighters. You have the floor. Good afternoon, dear colleagues. The issue of rehabilitation of the ATO fighters and the consequences of the military actions of warfare which take place today in our country are absolutely topical. According to the analysis provided by the Ukrainian physicians and doctors, the need for medical officers is almost they need almost 60% of the ATO fighters need the science, moral help, 30 physical rehabilitation, almost 100 psychological rehabilitation. Of course, it's very difficult to adapt to the absolutely the new terms and conditions of our life, especially to those people who eyewitness the deaths or the heavy casualties of their friends, and those who have to kill other people to defend our state. But anyway, they have to raise their arms and kill some other peoples. Today, this is very difficult psychologically. Today, this briefing is dedicated to the following issue. The state allocated 50 million hryvnia for psychological rehabilitation of the ATO fighters, and those funds today cannot be used due to the fact that there is not enough number, or generally there is none, of those who can actually make use of those funds and who can and must apply for tenders. Actually, we expect today from the mass media to convey this message that there are 50 million hryvnia funds which can and must be used for rehabilitation, and mechanism of its use and the needs will be disclosed by the representative, the head of the State Service for the War Veterans Department, Mr. Artur Derevyanko. Thank you, Olga. I would like to, in addition to what has been said, to provide the following information. In order to cover the maximum territory of Ukraine to provide the psychological rehabilitation to the ATO fighters, we proposed 116 lots covering 5 districts in each region in order to make use of maximum medical, non-medical, public and not public institutions to be involved in providing such psychological aid. But actually, we opened our proposals, and out of 116 lots, only 6 were used in Kyiv, Kharkiv, and Kirovograd region. We were actually shocked to understand that those institutions which can provide those services, the Second World War hospitals, which we have in each region, they did not even apply for this tender. Maybe there is some lack of understanding or some kind of misunderstanding or lack of comprehension maybe, and lack of awareness or how to do that. But the interdepartmental committee which was set up in our service actually involved all the medical officers and the researchers, and all recommendations were provided. I can visualize only one problem here. Those people who would like to provide the psychological services they did not follow the straight way. I mean the gathering of the package of documents in order to be part of the tender. So once again, I would like to tell them, do not be afraid to provide this documentation. We actually have 2 different directions where they can provide psychological assistance, like big time centers or the spas, or the smaller centers and the private persons. So I request all of you, and taking this opportunity of speaking here in the UCMC, I would like to tell you that the second round, our second stage of our procurement will take place on September the 1st. I mean disclosure of a proposal. So please make use, or all the institutions or institutes can provide such services. We have the public assets and funds which have been allotted. We have to use those for the sake of our defenders, our fighters. Thanks to Artur Derevyanko, head of the state service for what veterans, ATO fighters, and the ATO fighters. I have just a few words to add, but do not go. Maybe there will be some questions. I would like to say that what we have, those hospitals of the veterans of war, hospitals have been renamed. They are titled now Hospitals for the War Veterans. And I would like to ask you to look how, to which extent to Ukraine, well, Ukraine has a huge hospital base which must be used for rehabilitation of our fighters. In addition to the war veterans hospitals, in the Ministry of Health Ministry, we have 20 hospital departments and 30 hospitals. 6,500 of beds in those hospitals can be used on daily basis for providing the assistance to the ATO fighters. Also, I would like to ask you to acquaint yourself with a network of medical institutions which can be involved in rehabilitation services. The National Bogomolets, University Bukovina, Donetsk, Dnipropetrovsk, Zaporizhia, Ivano-Frankivsk, Lviv, Odessa, Ternopil, and Kharkivsky medical universities are those institutions or institutes which must be leaders, which have the theoretical basis and the research potential, which have to take care of providing this kind of rehabilitation. At another conference in the Ministry of Health of Ukraine, where we involved the chief physicians of war veterans hospitals, I proposed to bring the theoretical faculties to the basis of the hospitals, war veterans hospitals to bring together the theory and practice. I would like to draw attention of all our community to absolutely dissatisfactory implementation by some of the regions of their duties and obligations regarding the treatment, feeding all those who find themselves in the war veterans hospital. The worst situation in Chernovets and Kiev hospitals where they allot the minimum funds for medications from up to 10 hryvnia. Also, I would like to emphasize that all the funds have been allocated by the budget, both for treatment and nourishment or feeding, but today everything is still provided by the volunteers. They take care of additional medications, procurement, and food stuff. I would like to draw attention to the number of those ATO fighters who were offered treatment in all those hospitals. Officially, rehabilitation was given to 3,862 or 682 persons. This is very few persons compared to the demobilized number of the ATO fighters. The maximum number of ATO fighters were treated and rehabilitated in the following regions: Kirovograd,
Kiev, Tsible, Rivne, Cherkasy, Volynsk. The list numbers of rehabilitated servicemen, and you should compare this with the special hospitals. The list numbers were in Odessa Hospital, Dnipropetrovsk, Donetsk, in Svetohirsk and Zaporizhzhia. This oblast provided no rehabilitation for servicemen, even having available funding and special hospital beds. And I ask the question why they are not doing this, why the administration of those hospitals are not brought responsible, and why the ATO servicemen after treatment in the hospitals are not rehabilitated and with the facilities and with the necessary funding. Also, you can here see the algorithm how servicemen could be could apply for rehabilitation upon treatment in the hospital. And it requires just a will of the serviceman. It is not complicated. Now we speak about additional tenders to provide the psychological rehabilitation service, and when I see the volunteer organizations who would like to carry out rehabilitation, I immediately advise them to apply for these funds, but in compliance with the necessary procedure. Psychological rehabilitation includes not just treatment and special psychological rehabilitation in the hospitals. This also involves dissemination of materials which allow self-rehabilitation of servicemen. This is a brochure of famous American professor. It is translated by Ukrainian expert, and this brochure should be disseminated among all servicemen. Also, it could be freely downloaded from internet, from my website, and handled to all those who arrive from the ATO. Also, we have funded 3 stages of Frank Puselek course of training, and we trained up to 600 experts who were trained to treat the patients with post-trauma depression, which may result with very fatal consequences, including suicide or violence in society and in a family. That's why we have trained more than 600 experts who are practitioners who can work with the ATO veterans with post-trauma PTSD, and they have received qualification of trainers in the oblasts of Ukraine. They can held special training courses, and the next course for trainees will be in late September. We have 50 vacancies for such trainees. The training will be between September 13 and 18. This training is free for participants. You have to send your resume and application to bogomolets.com. Today we are creating a network of experts who are able to work with veterans. Our message is that unfortunately the allocated resources from the budget are not used, and that the government is not sufficiently fulfilling its commitment to provide psychological assistance to the ATO veterans. And now your questions.
Can you explain us why so? Because of the management of those hospitals, why they do not agree to do that? Maybe they do not understand how important it is. I can tell that they understand perfectly well everything. The only thing which I can say regarding the Dnipropetrovsk War Veteran Hospital, They have the psychiatric mental hospital nearby at Mechnikov Hospital. And I actually visited that hospital, but all the rest at least have to apply for this tender, because anyway the ATO fighters go through those hospitals, and even if they're not be provided with the beds in those hospitals or be nourished there, but they have to provide the psychological rehabilitation. They must be participants in this tender. For example, if you're talking about some hospitals which are outside of the cities, it's very difficult in Siberia, for example, to reach that. But next year, plan to introduce some amendments in to provide both for the accommodation and meals. That's why we actually provided those 116 lots in order to cover all the country if possible. I will try to add something to answer your question. We are talking about the personal factors or subjective factors. We take only hospitals which have all the beds occupied, and those hospitals which not only open their doors but also their hearts. And those hospitals who have a different personal or subjective attitude, they never open neither doors nor hearts. There are some of the hospitals to which the ATO fighters do not even want to approach, because the attitude towards them there is such they do not want to go there. So if you're talking about the situation, I believe that this is a shame, and the respective public organizations and the ATO participants must to change the attitude on the part of the society towards what they are doing. There are money, there are beds in the hospitals, but there is lack of desire or wish to do something about that. That's why the volunteers must activate their positions, not only to be involved in the procurement of medications in this case, but to activate the public structures which have to carry out their duties. And to do that not in a forced manner, but they have to open their hearts and wish to help those people who actually put at stake their lives in order to defend our motherland. How much psychological rehabilitation is necessary, and if they do not provide the timely this kind of rehabilitation, what would be the result of that? And do you have some figures, let's say number of suicides or let's say heavy PTSD cases? Today they registered dozens of suicides. They have been registered already. Regarding the total number, you won't see that figure in the near future. We can only talk about the tendency, because there are some acute conditions and there are some chronic conditions which, based on the experience in Serbia and Kosovo, this kind of condition can emerge within let's say period of span of time of 10 years. We are talking about the Vietnamese or the Eastern Syndrome. If we actually take an analogous experience of other countries, we can say that among those soldiers, U.S. soldiers who were killed in the Vietnamese War, there were 87,000 people, if I remember correctly, maybe a small error. 10 years later, after the completion of the war, among those who survived, 62,000. In other words, more than casualties during the war, they had suicide. So the suicidal casualties outnumbered those killed in action, and that was actually the need for the employers to take them back to the society, not only to rehabilitate, but also to return them to society. In this book, or the methodology of Poroshenko, they actually teach how to receive the people who had a absolutely different, unique experience. I personally do not belong. Well, although we have this term as rehabilitation, renovation, whatever, but I belong to those people who were in the front line and who witnessed the deaths of those people, the people who live in a different sphere of life, a different system of values, and the life to them ceases to be something valuable. And those who commit suicide, 62,000 American soldiers, half of those who were imprisoned in the United States, 50% of those were the Vietnamese war veterans. But in society, this ratio was 1 per 50,000 people. That means that the people aggressively responded to any kind of injustice, and there are some cases when, unfortunately, the response, the reaction, which is normal under the military conditions, in domestic conditions, can lead to very tragic consequences. In the United States, for example, there is one Vietnamese war hero who was imprisoned for life term for killing his own son. That was just an accident. He stood up, the TV was switched on, and there was a 6-year-old boy of his who was trying to wind up a toy, mechanical toy, and this sound reminded him like the spring of the submachine gun. And this former military guy just reacted as if he was just in the war situation. He just hit his son and killed him by one strike of his hand. He offered him some treatment, medical education. He said, "No, I'm a brutal animal. I killed my own son. I have to spend my life, the rest of my life, behind the bars." So, according to the proposal of Frank Purcell, if we do not develop this network here, I would like to thank Frank, who himself was through the Vietnamese war in Vietnam, who rehabilitated the participants in the 6 conflicts for the fact that he provided free of charge trainings in Ukraine, which are absolutely valuable for our society, because every member of the family, every child has to know what are the rules which the former war participant lives, according to which he lives. And if we know those rules, we can rehabilitate those guys. And there's a wonderful, Frank actually told about those principles and approaches during his interview, which you can find in YouTube, and everybody has to know about those rules according to which our soldiers and fighters live. And we have to know those rules, all those civil and peaceful citizens who live today. Then we won't have any conflicts. And those guys won't have any grounds for any kind of conflicts or crimes. And we have the network, which will be the basis for us. And those who are indifferent, and we are talking about those people today who do not provide the rehabilitation to the ATO fighters. I don't know, whether maybe they fear them or they do not want to do that. And we can say, shame those people.
I would like to add to what Madam Olga mentioned. We review not just the cases when former servicemen end with a suicide. We also keep an eye on all the incidents when former servicemen become the victims, either in their plants, in their production halls, or in the road incidents. And we have statistics when the former Afghan veterans, they died within first 10 years upon their coming back from the front line, and this confirms the research done by Mr. Pusalak. I believe that psychological rehabilitation should be delivered to all servicemen who come back from the front line. Because family members feel the consequences of life in the warfare, and we should not allow this negative phenomenon to appear 5 years after the war. Ukraine Crisis Media Center. You mentioned that the money is allocated for treatment, for food, for catering, etc. Why these money are not used whether some money were allocated to the hospitals, but they were spent not for the purpose. And when you mentioned 50 million, was it in hryvnia? 49,900,000 hryvnia. This is money allocated for rehabilitation, but they do not cover accommodation and treatment of the servicemen. This means that these people should receive this psychological treatment in their places of residence, and this service should be delivered by special institutions, or at least trained experts. And what you mentioned, this is annual funding for maintenance, for food, for accommodation of those patients who stay in the inpatient clinics. You know that there are only 30 hryvnia per day allocated for food of those who stay in hospitals, and 50 hryvnia for their treatment, which obviously is not sufficient. These 50 million, they are not spent. They are simply allocated. We do not see any applicants for this money. There were a lot of dispute who should be awarded these contracts for treatment. Who are those medical institutions? What does it mean, medical institution? Of course, we can change the terminology, but we need applicants for the tenders, and the best way and the best approach is to invite the hospitals for war veterans. That is, we want to add this new service, psychological rehabilitation, to the list of services delivered by the special hospitals for war veterans. Unfortunately, this allocated money, this 50 million, should be used this year, and this is specifically allocated for psychological rehabilitation. If we do not use them this year, then next year we need to look for another allocation of this funds. We have to prove that we are professionals. We have to check whether the rehabilitation, which will be organized by the applicants, that it will be delivered professionally. Today we have 600 trainers. We have 24,000 of professional psychologists who should be specifically trained to provide assistance to servicemen. We also have around 5,000 of sociologists who could be sociological workers who could be trained, social workers. We should guarantee that these funds which are already allocated, they are spent properly. I would like to describe the work of Kirovograd Hospital for War Veterans. They've created a vacancy of a psychologist, and they invited people to this position. They cooperate with volunteers, they bring servicemen just from the front line and assist these people and accompany them by the final day in the hospital.
Any other questions or clarifications? If none, thank you very much for your presentation. And we are going to complete this press briefing. Thanks again. This is brings us to the end of the working day in the UCMC, and the schedule of tomorrow will appear on our website.